get ready for a special edition Benjamin Fuchs live on a Memorial Day evening.
Labor Day. Labor Day.
I'm sorry, did I say Memorial Day? It's Labor
Day.
Day.
You know, I always tell my friends when it's Memorial Day, I say it's going to be Labor Day as soon as you blink your eyes.
As soon as you blink your eyes. Yeah, man, this year went by fast.
Holy moly, Liam. What the heck's going on? Our lives are disappearing. And that's why it's so important to stay healthy as long as you can. That's what we're going to talk about here today. Let me get my light going on here.
Yeah, this subject, people, we're going to be talking about osteoporosis, and Brent is bringing the receipts.
Osteoporosis. You know, I get calls on osteoporosis. It's probably one of the more common things people talk to me about is osteoporosis. And people have the idea that osteoporosis is a disease. It is not a disease any more than wrinkles are a disease.
That is such a powerful statement.
Right? Osteoporosis is just a degenerative condition. It's caused by the same things that cause all chronic degenerative conditions, which is a triangle of disease. Go to the doctor. There's nothing they can do. There's nothing in the pharmacomedical model's bag of tricks that can make your bones stronger. They do give certain drugs, most especially the so-called bisphosphonates. Show this first slide here.
First slide coming up.
Slide. The bisphosphonates are the most. Oh, no, that's the last slide. Liam.
I'm sorry, that is the last slide. Here is the first slide.
The first slide. Yes, the bisphosphonate drugs are associated with bone pain and joint pain and muscle pain and nausea and difficulty swallowing. And you got to stand up or you can't lie down for half an hour after you do your bisphosphonates. They can cause gastric ulcers. They're associated with a horrible condition called osteonecrosis of the jaw, and osteonecrosis is as horrible as the name sounds. Necrosis means death. Osteo means bone. Bone death of the jaw. Severe jaw deterioration. I mean, there's just horrible, horrible drugs. And considering that it's not a medical condition and it doesn't lend itself to pharmacotherapy, it's just tragic that people are dealing with these kinds of adverse reactions and side effects when you have so many other alternatives for dealing with osteoporosis. Next slide. Mr. Liam. So osteoporosis is an inflammatory condition. It is associated with the aging process, and like all diseases, it is linked to inflammation and the triangle of disease. This is an article that came out in Biomed Central. Osteoporosis is a relevant age-related disorder characterized by low bone mass, increased bone fragility. Osteoporosis is viewed as a condition that can occur at any age in life, although it mostly occurs in elderly folks and in women. There's about 10% of the American population suffers from osteoporosis, and 80% of that 10% are women. Next slide. So, surprise, surprise. Dysbiosis of the gut bacteria. First point on the triangle of disease. All chronic health conditions need to be backtracked to the digestive tract first. First point in the triangle of disease. This is an article from the journal Aging and Disease. Quote, dysbiosis, which means messed up gut bacteria resulting from alteration in various gut bacteria factors, may lead to changes in metabolites that regulate pro and anti-inflammatory processes and consequently impact bone health. Next slide. Gut inflammation and osteoporosis. Again, we see this condition that underlies all bodily breakdown, leaky gut, leading to toxicity in the blood. I call it dirty blood, leading to inflammation. This is an article from, I got this from almetric.com. Chronic inflammatory disorders such as IBD, irritable bowel disease, affect bone metabolism and are frequently associated with the presence of osteoporosis. Next slide. Here we have the relationship between histamine. We've talked about this before. Histamine is made by gut bacteria, particularly when you're dealing with excess bacteria in the small intestine. It's made by cells, immune cells that live in the small intestine, and it's also made by immune cells in the blood. Histamine is a very powerful inflammatory factor associated with the immune system. And this is a very interesting study that talked about bone mineral density in the neck may be higher in patients who use antihistamines. Now, I'm not recommending that you use antihistamines to build bone, but it just underlies the fact that histamine is associated with bone deterioration. And of course, histamine is a metabolite of gut bacteria, a secretion factor of gut bacteria, and it's associated with leaky gut, small intestinal bacterial overgrowth, as well as all chronic degenerative diseases. Next slide. Point number 2 on the triangle of disease: blood sugar and insulin and metabolic syndrome. From the journal Nutrients, the growing prevalence of metabolic syndrome and osteoporosis in the population, along with the findings on the relationship between the conditions, suggests the importance of investigation on the topic. Previous studies suggested that the two conditions, that is metabolic syndrome and osteoporosis, share common underlying pathways which affect regulation of calcium homeostasis. So you can see, if you're dealing with metabolic syndrome, if you're dealing with blood sugar problems, and you try to take calcium in order to build your bones, you're going to run into a problem, because metabolic syndrome is going to impair calcium absorption as well as calcium assimilation into the bone. Metabolic syndrome is the second point on the triangle of disease. You can see where we're going here. All chronic degenerative diseases have these 3 points in common: the digestive system, the blood sugar system. Next slide. And cortisol, the adrenal glands. This is from Hindawi Publishing. Findings indicate that, this is a study that was done on cyclists, indicate that cyclists should participate in weight training and increase calcium intake. This is all about elevated cortisol associated with exercise and osteoporosis. Next slide. We know elevated cortisol also leads to thyroid disease, hypothyroidism. Thyroid hormones are essential for normal skeletal development and normal bone metabolism in adults. What we're showing you here, folks, is that you cannot treat osteoporosis in a vacuum. You can't just take a drug for osteoporosis as long as you have leaky gut and digestive health issues, metabolic syndrome, hypercortisolemia or excess cortisol secretion, and excess decreases in thyroid hormone or hypothyroidism. Your bisphosphonate drugs, your calcium supplements, all the things that we do to build our bones, or strategies we use to build our bones, are going to be useless if you got these 3 points of bodily breakdown, which means focus on the triangle. Always, 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 no matter what your health challenge is, focus on the triangle of disease. Next slide. We also know that osteoporosis and exercise can be beneficial for osteoporosis patients. It turns out that the bones and collagen in general are piezoelectric. They generate, piezoelectric means they generate electrical charges when they're pressurized, or when pressure is placed on them. Piezo means pressure. Piezoelectric refers to the electrical charges that are generated when pressure is applied to the tissue. All collagen is piezoelectric, and that's collagen in your skin, collagen in your blood vessels, as well as collagen in your bone. So weight-bearing exercises are one of the most important strategies you can use to prevent or even to reverse osteoporosis. We know that astronauts, when they're in space, they will have to exercise. They'll have to put them on a treadmill or rebounder in order to prevent them from having deterioration in their bones. That's one of the things that used to happen with astronauts in low gravity or no gravity, zero gravity settings in outer space. Without pressure on the bones, without some kind of compression on the bones begin to deteriorate. So osteoporosis should be regarded as, in addition to being the end result of digestive health issues, metabolic syndrome, too much cortisol in the blood, hypothyroidism, it's also the result of a sedentary lifestyle. Get your butt in the gym. Start doing exercises, Pilates, or weight-bearing exercise, running, treadmill, squats. There's all kinds of ways that you can put pressure on the bones in order to stimulate growth. And then there, of course, next slide, Liam, there's nutritional supplements that you can use. While calcium gets all the press, and it's true that calcium is what makes the bones, as well as the teeth and the skeletal system in general, strong, the bones are mostly made of protein. So you got to make sure that you're getting enough protein, particularly collagen peptides and collagen itself, as well as whey protein, which in my opinion is the best protein going, best supplemental protein going. Meat and fish are good sources of protein, of course. And then also, I love whey protein supplements. And along the same lines, along with working out, along with doing protein supplements, collagen peptides, collagen itself, gelatin, also creatine. which is a supplement that bodybuilders will use to make themselves stronger, can also help with building connective tissue and collagen, as well as bone. Vitamin D is very important. Magnesium is important. Zinc is important. Calcium, of course, is important in addition to protein. Vitamin K is another very important supplement that can help keep calcium in the bone. So between working on digestive health, as using all the digestive strategies we talk about, eliminating problem foods, using probiotics, using your I-26 from Longevity. I love this product, I-26. I guess you can't see it here. Let me see if I can turn my light off. Maybe you can see this. This is an awesome product for killing excess bacteria in the intestine when you're dealing with SIBO. I don't know if you can see it. Yeah, it doesn't come out very well. It's called I-26. It's a hyperimmune egg powder. It's specifically designed to kill excess bacteria for folks who are dealing with SIBO, patching up a leaky gut using Longevity's Fucoid Z, which contains fucoidin in it. Collagen peptides and collagen can also have a strengthening effect on the intestinal lining. Glucosamine, Longevity's glucogel caps, are a wonderful supplement for building, for strengthening the intestine, also for building bone. Glucosamine can be very helpful. I forgot to mention that. Vitamin C, forgot to mention that one as well, is very important for building bone and building connective tissue. Lowering your blood sugar, keeping your blood sugar stable, reducing insulin, working on metabolic syndrome, lowering cortisol by practicing slow, deep breathing techniques, bodily relaxation, massage, psychological relaxation strategies, meditation. All of these will have a cortisol lowering effect, and it will also have a thyroid strengthening effect. And then using full-on nutritional supplementation. If you use the Longevity products, Longevity has a great kit called the Healthy Bone and Joint Pack. If you want to use individual supplements, as I say, vitamin C is very important. Essential fatty acids are very important. Magnesium, zinc, strontium, another mineral that's really important for building bone. Collagen peptides, protein, more protein. There's so many wonderful, vitamin K, vitamin D. There's so many wonderful nutritional strategies that you can use in addition to focusing on the triangle of disease for strengthening bone. And don't forget about working out, exercise. And by the way, when you use all of these strategies for building bone, not only will you be building the connective tissue or the collagen in your bone for building stronger bone, you'll be building the collagen in your joints. So you'll reduce the risks of degenerative joint diseases and arthritis, and you'll be building the collagen and the connective tissue in your blood vessels, reducing the likelihood of vascular health issues, and you'll be building the connective tissue in the heart, reducing the likelihood of heart disease, and maybe best of all, you'll be building the collagen and the connective tissue in your skin, reducing your risks of aging of the skin and wrinkles and skin thinning. So when you use drugs, you get toxicity, you get adverse reactions, you get very little positive benefits for the bone itself in terms of bisphosphonate drugs. But when you use nutrition and when you use exercise and when you focus on the triangle of disease, not only will you be building bone, not only will you be reducing the likelihood of having osteoporosis, but you'll also be strengthening your heart, your cardiovascular system, your skin, and all the other places where you have connective tissue and collagen, including the fascia inside your viscera, the fascia that covers all of your organs. So it always pays to use nutritional and lifestyle strategies when you're dealing with a health challenge, particularly osteoporosis, which although it gets considered or it gets treated as a disease, and if you go to a doctor, you get pharmacological strategies, you want to think of osteoporosis as a symptom, a sign of bodily breakdown, which always should lead you to the triangle of disease, nutritional supplementation, and lifestyle strategies.
That was outstanding.
Thank you.
So protein.
Protein. The bones are mostly protein.
First time I've heard of that.
Yeah, everybody talks about calcium.
Right.
Hormone replacement therapy or bisphosphonates. Your bones are mostly made of protein. Yeah, there's calcium in there that strengthens it along with zinc and strontium and magnesium. It gives the bone a certain strength, but it's mostly protein. The bones are mostly are a type of connective tissue, and connective tissue is mostly made up of collagen, as well as the GAGs or glycosamine and glycan. So making sure you're getting enough protein. And if you have digestive health issues, oftentimes we don't absorb our protein. You need stomach acid to absorb protein. You need digestive
Sure.
enzymes to absorb protein. So if you're dealing with the triangle of disease, there's a very good likelihood that you're not going to be absorbing your protein.
Yeah, and you hear many times people be like, oh, protein, and you're going to stress out the kidneys or the liver or whatever.
Right. No, you don't want to overdo the protein, but certainly 50 grams or 100 grams of protein a day. And there's around, just to keep it all in context, you get maybe 7 to 10 grams of protein in one egg. So the same amount of protein that's in 4 or 5 eggs, or 6 eggs maybe, that's the amount of protein most of us need, around 50 to 100 grams of protein or so. If you're a bodybuilder, you're a weightlifter, you're an athlete, you're recovering from surgery, you're pregnant, you may need more protein. But for most people, 50 to 100 grams of protein a day is usually enough.
And we've got a little shout out from Patty. Let's say hi to Patty.
Oh, hi, Patty.
As always.
I forgot we got people on the call here.
Great information. Thank you, Patty. Please leave your questions and comments. This is a great place to get the information you need. I myself, I love this subject, osteoporosis, because I used to squat a lot.
Okay.
I had like 5 plates going at a time,
Is that right?
Yeah.
Right?
What is that?
45 pound plates?
405, I think that thing would bend.
That's crazy. How long ago was that?
That was in my,
when you were a kid?
maybe, when I was a kid, maybe 30 years ago.
Wow.
And so I didn't realize it, but I was not supplementing, and so my skeletal thing was deteriorating, and so I started to get problems with the upper back and neck. And just recently, I went to a chiropractor, and he wouldn't work on me because my upper back was so fused together. He said I had DISH.
What is that?
Some kind of debilitating internal spinal.
Okay, it's an acronym.
So, but I got my FX going on. I don't know if you can see, and I got my.
That's part of the health. Yeah, that's part of the healthy bone and joint pack. That OsteoFX is awesome. Not to mention, there's phosphorus in there too, and phosphorus is another. Most people aren't going to have a phosphorus deficiency, but phosphorus is another very important mineral for bone health. Calcium phosphate, calcium and phosphorus together are important for strengthening bone, and as I say, strengthening all connective tissue. The bones are part of the connective tissue. When you use nutrition and lifestyle strategies to build the connective tissue in the bones, you build the connective tissue all over the body.
And Patty also has another great question here. How to correct bone spurs? Fantastic question.
Bone spurs should be regarded as a sign that calcium is leaking from the bones. And this is another cause for osteoporosis is when the blood is acidic. The body will use calcium to neutralize the acid. Acid is associated with toxicity. Acid is associated with degeneration. Acid is associated with cell death. As cells are dying, as we become toxic, as we're degenerating, acid is dumped out into the blood. If you have kidney issues, which occur as we age, you may not be clearing your acid as effectively. The blood pH starts to drop. The body has a mechanism for buffering or for raising the pH of the blood, and that mechanism involves leaching calcium out of the bones. When calcium leaches out of the bones, it'll have an alkalinizing effect on the blood, but eventually calcium can deposit in various tissues, and these calcium deposits can result in what are called bone spurs, as well as calcification of the blood vessels or calcification of the brain or calcification of other soft tissues. And in fact, calcification, which follows this blood acidity, which in turn follows toxicity, is one of the ways we die. We actually calcify to death. Our heart calcify. We turn to stone, essentially.
Wow.
Our heart and our soft tissues will calcify as the body leaches calcium out of the bones in order to raise the pH of the blood. So what you want to do is you want to regard bone spurs and calcification of tissues as a sign that you're toxic and as a sign that the blood is acidic due to that toxicity, which again points us to the triangle of disease, because this is how toxicity enters into the bloodstream through a leaky gut, through dysglycemia, and elevated cortisol ultimately will compound the problem. So focusing on the triangle is always your solution. If you have bone spurs, nobody just wakes up in the morning with bone spurs out of the middle of nowhere. Kids don't get bone spurs. Bone spurs are a sign of long-term chronic degeneration, which follows, as I say, blood toxicity and the body's attempt to neutralize that low blood pH, or neutralize the low pH of the blood. Blood has to stay slightly alkaline. As soon as it drops, that represents an emergency state to the body. Calcium comes out of the bones to raise the pH of the blood. That calcium will eventually find its way in the soft tissues. And this is, by the way, why vitamin K is so important. Vitamin K is like a magnet that keeps calcium in the bones. And vitamin D, of course, is also important for getting calcium into the bloodstream through the intestine. So the fatty vitamins, vitamins D and vitamin K, are two very, very important vitamins for keeping calcium, for getting calcium into the blood and then keeping calcium into the bones.
Fantastic question, Patty. Thank you so much.
Patty.
And that looks like it's about it for the questions. I don't see any more coming in.
Happy Labor Day, my friend Liam, and everybody
listening.
Happy Labor
Day, Ben. Happy Labor Day to everyone listening. Thank you so much for tuning in. Have a great holiday, and
see you next Sunday.
I guess we'll see you next Sunday.